we're going to continue our discussion of psychological disorder treatments by continuing to talk about the behavioral therapies that are used. We talked about the classical conditioning techniques. Now we're going to talk about operant conditioning. Remember, operant conditioning uses rewards and punishments to either increase behavior or decrease behavior. So basically they're doing the same thing. They're using behavior modification in which desired behavior is rewarded and undesired behaviors are either not rewarded or are punished. So using these reinforcements and punishment techniques that we talked about. They found this successful with a number of 3-year-old autistic children who were trained by giving and withdrawing reinforcements for desired and undesired behaviors. They use a technique called applied behavior analysis. And basically what this was is when the 3-year-olds would do something that they wanted them to do, they would give them a treat, and when they didn't do that, they would either not give the treat or punish them. This can be used in an institutional setting, such as a token economy, where patients exchange some sort of token or money for a privilege or for treats. It can be used in classrooms, but yeah, so a token economy can also uses these rewards and punishments. So that's behavioral therapy. Now let's move on to cognitive therapy. So cognition, remember, the buzzword is thinking about thinking. That's what cognition is. And what cognition does is instead of looking at the behaviors, we're now looking at the thinking that people are doing. So not necessarily how they're acting, but why they are thinking the way they are, and how can we change that thinking. So behavioral therapy was trying to change maladaptive behavior. Cognitive therapy is trying to change maladaptive thinking and replace it with appropriate thinking. So we're controlling someone's thoughts and their self-talk. So for example, if someone lost their job, their internal thoughts might be, I'm worthless or I'm hopeless, and this could lead to depression. But if we change the way we think about things, so if you lost your job, your internal beliefs are now, my boss is a jerk or I deserve something better, now you don't have depression. That's this very basic, simple idea of cognitive therapy. So when using this with depression, Aaron Beck suggests that depressed patients believe they can never be happy. So their thinking is telling them that they can never be happy. Therefore, they associate minor things like failing a test or failing some sort of event as a cause for their depression, when really the cause is their thinking, not the event, okay? And so what he believed is that these thoughts, like I can never be happy, need to change. We need to change how people think before we can change and help their depression, okay? So this change in their thinking is brought about by patients answering some gentle questions, okay? So Rabin et al. In 1986, they trained depressed patients to record positive things that happened in their life and then how they contributed to those positive events. So basically, what part did they play in those positive things that happened to them? And what they found is that when these patients were compared to other depressed patients, the patients who learned to think positively showed lower depression scores. So changing their thinking can help that depression. Some other types of cognitive therapies, like I said, cognitive therapy before is thoughts, feelings, and behaviors are all influenced by each other. The basis is shifting the thinking or the cognition that allows for emotional and behavioral changes to take place. So in order for the behavior to change, in order for the emotions to change, you need to change your thinking first. Rational emotive behavior therapies, or REPT, believes that the problems come from irrational thoughts, okay? And so this type of therapy involves showing someone that their distorted thinking is distorted, okay? So you think that you suck? Well, let's show you that this is not true. You don't suck. Okay, this is controversial because sometimes it can feed into someone's distorted thoughts, and it can prove or support those thoughts if they can't disprove them for that person. Okay, the next is CBT, or cognitive behavioral therapy. This is aiming to change the way people act and the way they think. So combining behavior and therapy, this is probably the most common. So combining behavior and cognitive into one. And it's changing the way you think about a certain behavior. Okay, so okay, I feel really anxious when I'm doing this behavior. I'm going to stop that behavior and see how I feel. The next is stress inoculation training. I'm not even going to try to pronounce that person's name, but they train people to restructure their thinking in stressful situations. So instead of thinking, oh my gosh, this test is going to be really hard, I'm going to fail, now you're training yourself to say, okay, I need to relax. This test is going to be hard. Yeah, I know that, but it's going to be hard for everyone. I studied really hard. I don't need a perfect score to get a good grade. I don't need a perfect score to be a good person. So it's retraining the way that you think about stress. Okay, so we do this a lot of times in class, right? Like you all come in on test day or on a quiz day, and you're like really freaking out, and you're like, okay, but you guys studied, you know this stuff, we're fine, you're gonna do just fine. Okay, some other types of therapies are group therapy. Group therapy normally consists about 6 to 9 people, however, it can consist of more. They're usually about 90 minutes long and can help more people at once and cost less. Usually, this benefits people because they realize that other people have similar problems to them. And so they feel like a sort of camaraderie with those other people. Think of things like AA or a loss group or grief group, right? Like those are all group therapy where you can kind of support each other while you're going through the same things. And then the next is family therapy. Family therapy treats a family as a system. Basically, it's treating each family member as an important part of the working system, and it guides those family members towards positive relationships with one another, and each finding their own individual path within the family structure, and helps to improve communication. Okay, let's talk about drugs. So biomedical treatment of disorders is usually pharmaceutical drugs. However, there are some other therapies as well. We're going to focus mainly on the drugs. So here's a rule of thumb. When we're determining what a drug treats or how a disorder would be treated with drugs, we need to consider what the neurological cause of the disorder is first. We need to figure out, okay, what's wrong with the brain and how do we need to change something? How do we need to fix it? Okay. So for example, depression is an undersupply of serotonin. Okay. We don't have enough serotonin. So what do we have to do? Well, we need a drug that is going to increase the amount of serotonin in that person's brain. Okay, so the first one, antipsychotic drugs. This is for schizophrenia. So these include, I'm terrible at pronunciation, I can't pronounce them. Clozapine, Seroquel, Risperidone, Zyprexa. And what these do is they block dopamine receptors. So schizophrenia, there is an increase in dopamine, right? There is too much dopamine in that person's brain. And so in order for us to treat that, we need to block those dopamine receptors so that there's not as much flooding of dopamine. So it's an antagonist, right? Usually we can see the results in about 4 to 6 weeks for this. However, there are side effects, right? Because we are blocking that dopamine, that feel-good drug, now we are feeling sluggish. Some people have tics or other involuntary movements that are called tardive dyskinesia, lowering of white blood cell counts. You can have weight gain from these. And so these are going to focus on blocking serotonin and dopamine in the brain. Okay, Bipolar disorder is going to be an anti-manic drug. Okay, lithium is probably the most common. It also can be some other anticonvulsant medication like Depakote. And usually what this one does is it reduces the manic activity. So it kind of slows down the brain, right? Like brings that brain down to where it needs to be. And usually lithium works within a week. However, it's very powerful. So much so that if you take too much, it can be toxic. And so the person and the therapist that they're working with need to be very cautious to not take too much of this because it can be toxic. Antidepressant drugs, there are a couple different types, SSRIs, Prozac, Zoloft, Celexa, and Lexapro, and SNRIs, which is Effexor and Cymbalta. And so SSRI are inhibiting the reuptake of serotonin. Okay, so remember, depression is caused by a lack of serotonin in the brain. And so we want more serotonin. And so what SSRIs do is they block the reuptake of serotonin. And that leaves that serotonin in the synapse to be absorbed again. Okay? So SNRIs inhibit the reuptake of serotonin and norepinephrine. So they work similarly, but we have this SN, that N in there for the norepinephrine. These are going to work very similarly. Again, they're going to block the reuptake, and so they're going to allow norepinephrine and serotonin to float around in that synapse until they're reabsorbed by the receiving neuron. Some side effects of these are dryness of the mouth, constipation, headaches, and weight gain. Anti-anxiety drugs, these are benzodiazepines like Librium, Valium, Ativan, Xanax. And what these do is they reduce the intensity of the response to the stimuli that signal punishment and frustration. So these are going to kind of slow down our sympathetic nervous system so that when we notice some sort of anxiety-provoking stimuli, our body's not going to get that anxiety-provoking response. And it's going to kind of lower those inhibitions a little bit. However, some side effects of this, drowsiness, the reduced ability to concentrate because we're slowing down the brain, right? Slowing down that sympathetic nervous system, that ability to concentrate isn't there. You might feel lethargic, and then you might physically get dependent on this medication because you need it to bring that fear response down. Okay, so some other therapies that are not drugs, ECT, electroconvulsive therapy. There's really no real forms of this, but what we use this for, it's shock therapy. It's used to treat severe depression. And basically what it does is it passes an electrical current through the brain with electrodes that are on the brain. And basically what we've seen that it does is it resets the hypothalamus, and which then resets the hormone levels. And there's really not a lot of information out there yet. And so we're not sure if this is what helps the symptoms of depression or not, but some people with severe depression do see immediate effects of this. However, there are side effects, but they're very, very small. So some very small effects on memory. However, that's really all there is. But because of the, I guess the name, the electroconvulsion therapy, people still worry about the safety of ECT, even though there are very, very small side effects. And then finally, psychosurgery. So lobotomies are still done today. And basically what they do is they sever the nerves between the frontal lobe and the centers of the inner brain. And it's going to, kind of keep those pathways from happening. And so the frontal lobe, where someone might have a lot of that impulse control is there in judgment, if someone lacks that ability, if we sever those structures,